All right. Welcome, folks. Welcome to Every Artist Insured, Understanding Your Options in New Jersey. My name is Samantha Clark, and my pronouns are she, her. I'm a cisgendered white woman who has I have blonde hair, which is tied back, light eyes, and today I am wearing a black turtleneck and a black sweater. I am the program officer for arts education and lifelong learning here at the New Jersey State Council on the Arts. I am supported by my colleague Steph Nurbach, Artist Services Manager at the New Jersey State Council on the Arts. Either one of us is ready and able to help support you today. If you need us after today's webinar, you are welcome to email us. Our contact information is now in the chat. It is my pleasure to welcome you to the first workshop of The Business of Being an Artist. This is a workshop series presented by the New Jersey State Council on the Arts. Through this series, we will explore tools, resources, and best practices to ensure that every artist has a successful and sustainable career. In today's session, Every Artist Insured, we will learn about health insurance options in the state and what options are best for you. You can access the resources for this workshop, including the presenter bio, the slide deck, and more by accessing the link that is now placed in the chat. Excuse me while I copy that. This workshop is being recorded, so if you prefer to not be seen on camera, please turn your camera off. Please note that the question and answer portion of today's workshop will not be recorded. In today's session, Every Artist Insured, we will learn about as a note, we will not be covering Medicare during this session. For more information on Medicare, please see the link in the resource folder. As we go through today's workshop, please feel free to share any questions you may have in the chat. At the Q&A portion, I will uplift any questions shared and our presenter will address them. Again, this will not be recorded. If you'd like to send your question privately to me, you are welcome to do so. And now, it is my pleasure to introduce our presenter for today. Renata Marinaro is the National Director of Health Services for the Entertainment Community Fund. She counsels professionals and small businesses in the entertainment industry nationwide on healthcare coverage options. In March 2017, she helped launch the Samuel J. Friedman Health Center for the Performing Arts in partnership with Mount Sinai Doctors. Renata is a certified health insurance navigator and a licensed insurance broker. Her goal is to create educated and active healthcare consumers. She has written online insurance tutorials and educational cartoons and a guide on the Affordable Care Act called Every Artist Insured. Renata is also a licensed social worker. Prior to joining the Entertainment Community Fund, she worked in oncology and substance abuse treatment at healthcare facilities in the New York metro area. Again, it is my pleasure to welcome you, Renata, and the show is yours.
Great. Thank you very much. I feel like I'm being introduced on the Oscars. Thank you Samantha, you have a fabulous voice for that. Welcome, everybody. Thank you so much for being here. I'm glad you're here. At the end of this, you are all going to be health insurance ninjas. You're going to know this crazy system inside and out, and you're going to understand where you fit in. So basically, the run of show today is that I'm going to go over some basic vocabulary because you need that when we're talking about insurance. You need to understand what a deductible is. For example, there's a lot of confusion about that. We're going to talk about what your rights are as a consumer. We're going to talk about where you go to enroll and when. In the middle of the presentation, I'm going to go over your income and how to estimate it, which is super important when you're trying to get a good deal through the system. And it's also tough for people that are in the industry because your income changes so frequently. The second half of the presentation is going to be about how to pick plans and understand different programs that are available to you. So in New Jersey, you do have Medicaid. You also have the marketplace, and we're going to talk about how to pick a plan. As Samantha said, we're not going to talk about Medicare, which is for people 65 and over and the disabled. But we do have a Welcome to Medicare webinar every Monday that you can come to if you'd like. You would just go to the website you see here, entertainmentcommunity.org/AHIRC, and then you could sign up for that. At the end of the presentation, we're going to talk about what to do if you're uninsured. How do you get health care? How do you get discounted medications, etc. As Samantha said, please put your questions in the chat. So you will be muted for the presentation, which is going to be about 40 minutes long. We will have more than enough time to answer all your questions. Just put them in the chat and we'll read them out loud at the end and answer them. All right, so just a few words about what we do at the Entertainment Community Fund. We're a National Human Services organization. We strive to help all professionals in performing arts and entertainment. We're really designed to foster stability and resiliency and provide a safety net for people in this industry, which of course has been key during the pandemic and the work stoppages, etc. The Artist Health Insurance Resource Center is the program that I help run along with a fabulous team of navigators and agents. And we do these kinds of online seminars with live Q&A. We help people understand their options if they're under 65 or over 65. We do one-on-one assistance. So you can go to the website that you can see on the screen, entertainmentcommunity.org/AHIRC. And sign up for a one-on-one consultation. We just recently changed to a portal system. So this does mean that you would have to create an account. And all that involves is creating a username and password. If you would like to receive counseling, we're going to ask you some questions. Again, all of this is free, but we need to understand where do you live, because that will determine who we assign you to and what your issues are. That will also determine which navigator we assign you to. We do provide online educational materials. You can see these healthcare tutorials are on our website. They're short cartoons that explain all different types of insurance topics, like, how do you lower your dental costs, for example. And then we do advocate for legislative changes. So in New York, there's something called the COBRA subsidy. Unfortunately, this is only in New York because it's a New York legislative action. But it does help people who live in New York cover their COBRA costs, and that is something that we have advocated for many, many years. So let's talk about vocabulary. So most people know what a premium is, but if we have people from other countries here, a premium is a subscription to your insurance. In this country, they don't take it out of your paycheck. You actually pay a monthly premium, or sometimes it's quarterly. A deductible is what you pay up front before your coverage kicks in. What that means is you go to the doctor and let's say there's a $250 deductible on your plan. That's an incredibly low deductible, but let's just pretend that that's what your deductible is. And that's for the year. The deductible applies for the year. And you go to the doctor and the office visit is $150. You're paying that $150 in full. And the doctor says, you need to pick up this fancy cream at Walgreens. And so you go to Walgreens and the full cost is $100. And you pay that full price. Now you've paid $250 in out-of-pocket medical expenses, and your deductible was $250, which means you've satisfied that deductible and you don't have to worry about it anymore. Once you've satisfied the deductible, you have copays and co-insurance. So a copay is a flat fee, like $25 or $40 for a service. Co-insurance is a percentage of the bill. So let's say that you have 20% co-insurance. You look at the form that they send and it says 20% co-insurance. People often ask, is that what I'm paying or what the insurance company is paying? It's what you are paying. So that's your portion, and the insurance company's portion is 80%. Co-insurance is more confusing than co-pays because you don't know when you walk into a doctor's office what you're going to pay. That's part of the problem with the system. You could walk into a doctor's office and think that you're just there for a routine visit, and you walk out having done lab work and an x-ray and having spent a half an hour with the doctor. That is all going to be billed at a very different rate than if you just walked in for a 5-minute consultation with a doctor. And you don't know when you walk in what it's going to be. So that's why co-insurance is more confusing, because it's a percentage of the total cost of that service, but you don't know what that is when you walk in necessarily. The out-of-pocket maximum this year is $9,100. This is something that the Affordable Care Act instituted. The idea is let's put a cap on how much somebody spends in a year on medical expenses if they're insured. And so that cap is $9,100 this year. Tomorrow we'll find out what it is next year. It's probably going to be maybe 9,500 or 9,700 or something like that. So it goes up a little bit every year. And this means that the sum of your deductible and any copays or coinsurance that you pay is not going to be more than $9,100. Once you've paid that out of your pocket in a year, you don't owe anything else except for your premium. In-network and out-of-network relate to HMOs, EPOs, and PPOs. So an HMO and EPO are a type of insurance policy that basically mandate that you go to a doctor that they have contracted with. That's what's known as an in-network provider. So you are going to somebody that the insurance company is contracted with. If you go out of network, that means you're going to a doctor that has not contracted with your insurance company. That you can do if you have what's called a PPO. You can only do that with a PPO. PPOs are more expensive because they give you more freedom. You can see all kinds of doctors, right? So it's important to understand the policies that you're looking at, and they are almost always identified as an HMO, EPO, or PPO. Again, HMO and EPO mean network doctors only. The federal poverty level is what the government thinks you can live on. So I would love to see them live on this. This is, if you're below this line, then it means that you're poor, according to the government. If you're above this, it means that you're not. I don't think anybody anywhere in this country can even cover their rent or their mortgage on this, let alone all of their expenses, right? But the reason why I bring this up is because this is what your cost of insurance is based on. So where your household income is in relation to this number will determine how much you pay for insurance. That's how the system works. So if you are at 100% of this number, you're going to get free insurance. If you're at 200% of this number, you're going to pay a small amount for insurance. 300%, it goes up, up, up. So that's the metric. The marketplace and the exchange are the same thing. It's a website that you go to look at what your insurance options are and enroll in them, and you will see that information further on down the line in this presentation. And then the advanced premium tax credit is just that. It is a tax credit that you get in advance to lower the cost of your insurance premiums, and I will talk in detail about that at the end of the second half of this presentation. All right, so the cool thing about what we do here at AHRQ is that we can give you an overview of all of your options, right? So if you were to go to a private insurance broker, they generally contract with a few insurance companies, not all. And so they make money off of a few insurance companies, and they may not tell you about all your options. They may tell you only the options of the insurance companies that they contract with. We will tell you all of your options. Also, if you were to go, let's say, to a Medicaid office, they wouldn't know anything about private insurance. They would only know about Medicaid. We can tell you all of your public options as well. So we have the broadest overview of public and private options when it comes to insurance. And these are your options. You can get COBRA if you had coverage through a job or union. You can buy directly from an insurance company. I would not recommend this because they don't care what your income is. They will charge you a flat rate, even if there's a pandemic, even if there's a work stoppage, they don't care. Whereas the marketplace does care about your income, and they will peg the premiums based on your income. So it will be a sliding scale of premiums based on your income. And then you might be eligible for Medicaid. COBRA is a law that lets you keep your job or union coverage for 18 months and sometimes longer, for example, if you become disabled. You have 60 days to choose COBRA and 45 days from the date that you've chosen it to pay your premium, but you do have to back pay. So if you decide at day 60 that you're going to sign up for COBRA, and then you wait another 30 days to pay the premium, you're actually back paying 3 months of premiums for that. COBRA premiums equal the full cost of your health insurance. COBRA is not a different kind of insurance. It's just a law that says you can keep your insurance that you have through your employer, but instead of the employer footing part of the bill, you're paying the whole bill. So that can be very expensive. A typical price for employer-based insurance is anywhere between $900 and $1,400 a month. So let me talk a little bit about what your rights are as a consumer. So insurers cannot refuse coverage to anyone or exclude pre-existing conditions. Thank you, Affordable Care Act. There's no penalty for being uninsured in New York and most other states, but there is a penalty in New Jersey. The penalty in New Jersey is 2.5% of a household's income or a per person charge, whichever is higher. The minimum penalty is almost $700 and the maximum penalty is a little under $3,700. That's for a single person. You're going to pay this if you're uninsured for 3 months or more. That's why it's really important to maintain continuous coverage. Most plans cover preventive screenings for free, including mammograms, colonoscopies, pap smears, certain types of tests. Your COVID vaccine and your flu vaccine are free. That's because of the Affordable Care Act, certain types of STD testing, etc. Let me talk briefly about the difference between preventive screenings and diagnostic screenings. A diagnostic screening is when you go to the doctor because you have a symptom. You found a lump, there's something wrong, you want something figured out. That's a diagnostic screening. Those are not mandated to be free. They can be free, but that depends on your insurance company. Preventive screenings are the screenings you get every year if you're a woman after the age of 40, in terms of mammograms, pap smears every year for most women, colonoscopies after the age of 50, every 10 years, etc. That's a preventive screening. Medicaid was also expanded to cover people with incomes up to 138% of the federal poverty level, which means that anybody making less than $20,000 a year in 40 out of the 50 states of this country will get free comprehensive insurance. Unfortunately, there are some states that have opted out of this, which is a real shame, but New Jersey is not one of them. So if you live in New Jersey and you make less than roughly $20,000 a year as a single person, you're going to get free comprehensive insurance. As I said, not a good idea to buy from an insurance company directly. The policies are going to be more expensive because you're not getting a discount based on your income. They're more likely to be junk insurance, and I'll talk about that in a second. And as I said, agents work on commission and they have an incentive to sell the companies that they're contracted with. Navigators and assisters are certified to give accurate, objective advice. And that's what we have on our team here on the East Coast. We have navigators and assisters. Junk insurance comes in two flavors, faith-based share plans and short-term plans. Short-term plans are easy to spot because they're 3 months long or 6 months long. Technically, they're not legal in New York and New Jersey, but they don't have to be based in New York and New Jersey to sell to you. So these companies are based in Georgia and Florida and Texas, where the rules are different. They may be cheaper, but they do not have to comply with ACA regulations. This is a real issue. So those rules I talked about with pre-existing conditions don't apply to either of these types of insurance. That's why we want you to stay away from this type of insurance. Short-term plans will do stuff like they'll say, we cover hospitalization, and then there's an asterisk next to it, and nobody looks at page 98 or wherever the asterisk is actually located. And what you would find in that situation is it'll say something like, we cover hospitalization, but only on Tuesdays and Wednesdays. And that's not a joke. That's an actual policy that I've seen. So good luck if you don't show up at the hospital on Tuesday or Wednesday. And then faith-based share plans are not health insurance. That's why they're called share plans. Most people miss that fact, and they think it's health insurance, because what these plans will tell you is, we are a faith community and we pool our money, and if you get sick, we'll pay your bills, which sounds lovely, except that they don't have to abide by any rules or regulations. It's a completely unregulated field because it's not health insurance. It's a faith community pooling their money. And so they can tell you that you didn't pray enough. They can tell you that they don't cover mental health at all. They can tell you that they don't cover any pre-existing conditions. They can tell you they don't cover certain types of medications or reproductive care. It's totally up to them. Red flags include any mention of a membership fee. So monthly premiums are, of course, standard in health insurance. Membership fees are not. If it says not major medical, or if it says discounts of up to a certain amount. So when do you enroll? So in New Jersey, open enrollment is from November 1st to January 31st of every year. There used to be a deadline of December 15th. That's not the case anymore. So November 1 to January 31 of every year. If you live in New Jersey, you're going to go to nj.gov/getcoverednj. If you want to apply for Medicaid or NJ Family Care, you're going to go to njfamilycare.org, and we will talk about Medicaid in the second half, and this website will pop up again. If you need help with this process, please reach out to us at entertainmentcommunity.org/AHIRC. We can help you with this process. Now, if for some reason you're not enrolling between November 1st and January 31st, or let's say that you lost your job, for example, outside of that time period, that's okay. There are things called special enrollment periods based on life events. So you can get a special enrollment to enroll outside of open enrollment. Again, that's November 1st to January 31st. If any of the following things happen: you lose your job or union or COBRA coverage, you get married or divorced, you're pregnant or having a baby, you move to another county or state, you have a change in immigration status, for example, you get a green card, or you turn 26 years old and age off your parents' plan. In these situations, you have 60 days from the date that those things happened to enroll in coverage. If you don't do it within those 60 days, you're going to have to wait until the next open enrollment period, which will start next November 1st. There are exceptions to these timelines. If you're eligible for Medicaid, you can apply at any time. If you want to put a kid on CHIP, which is known in New Jersey as NJ Family Care, you can do that at any time. And if you're buying insurance for a small business, you can do that at any time. A small business is more than one person. A small business is two or more people not related to each other. And married people are considered to be related to each other. So if you are a married couple running a business, you would have to have one other person working for you in order to get small business insurance. So what happens when you go to this marketplace? It's It's asking you for a bunch of information. It wants to know your household size and your household income. That means if you're married and your spouse has insurance and doesn't need it through the marketplace, their income still has to be listed on this application. So once you tell them what your household income is and some information about your household, they're going to try to figure out if you're eligible for Medicaid or what type of an advanced premium tax credit you're going to get to buy what's called a qualified health plan. Qualified health plans are regulated private insurance products that you buy on the marketplace. Medicaid will be processed faster in New Jersey if you apply through njfamilycare.org. So, well, we'll talk more about Medicaid in the second half. Before you go online, you're going to want to have a bunch of information. And one thing that people don't think about is what their doctors are in network with. So you're going to want to call your doctors before you apply and ask them what they're in network with on the marketplace. And the reason for that is that insurance companies have very different networks. So Blue Cross Blue Shield might have one doctor network for SAG-AFTRA members, and they might have a very different network for people on the marketplace and another network for government employees that they insure. So there's all these different networks out there. All you see is Blue Cross Blue Shield and you think must be the same network. Not the case. So please, before you apply, call your doctors and ask them what are they in network with on the marketplace. And then, of course, you're going to have a bunch of information that you can probably guess they would want, like your social security numbers, your income, your household income, and any kind of immigration documents. If you are an immigrant, they will ask for the numbers from those documents. So before the Affordable Care Act, there were all kinds of like crazy plans that just covered certain things. And people were kind of upset that the Affordable Care Act was going to mandate comprehensive insurance. And some people. And I think now that we've lived through a pandemic, we know that crazy things can happen. It's good to have comprehensive coverage. So all of these things are covered, whether you're on Medicaid, which is free, or a qualified health plan, which you pay for, right? But the question is, what is the cost for these things? So that's where these things differ. But all of these things are what are called mandated essential benefits. Coverage of abortion now depends on state laws. New York and New Jersey consider abortion a covered service under Medicaid and qualified health plans and other private plans. All right, so we're in the middle of the presentation. We're going to talk about income. This gets a little complicated, but it's also super, super important. So a few things about this. First of all, we're right on the cusp. So we are tomorrow, open enrollment starts. There are some people that are looking for coverage for January and next year. And there are some people that are looking for coverage for November 1st or December 1st. If you're looking for coverage for November 1 or December 1, you're going to estimate your 2023 income. That's pretty easy to do at this point because we're 10 months into the year. So you add up all the income that you have for the first 10 months, and then you add up anything that you think you might make in November and December. If you're applying for next year, even if you're literally applying November 15th, December 1st, if you're applying after November 1st for next year, you're going to estimate next year's income. So we are going to talk about how to do that. There's two ways to do that. The first way is the easiest way. You are going to use line 11 of your most recent tax return. And that is where you will find your adjusted gross income, which is what the government is interested in. So if you think that next year's income will be within 10% of line 11, put the number on line 11 in the application, because what happens is behind the scenes, that application is pinging the IRS. And if the IRS says, yep, they made $29,342, it's going to be an easier application process for you. However, most people are not going to make what they made in 2022, because in 2022, we were getting government checks, they were getting pandemic checks, unemployment, etc. So for most people, their income is going to be different. So what do you do? If you are currently in a W-2 job, whether it's part-time or full-time, as long as it's W-2 and you don't imagine that you're quitting anytime soon, or the job isn't ending for some reason, you're going to add up your gross W-2 income for next year, base it on what you made this year. Gross means before taxes are taken out. If you have self-employed income, you're going to use net self-employed income. That means you can deduct business expenses. Business expenses are things like supplies, transportation, rent, etc. You can deduct business expenses. You need to speak with an accountant about what those expenses are for you, but you will want to do that, right? So your self-employed income can be net. And you can base your estimate for 2024 on what you made this year in self-employed work. You're going to include any other sources of income, interest, unemployment benefits. If you are receiving unemployment benefits now and you know that you have another 6 weeks into 2024 of unemployment benefits, you're going to include gross unemployment income for 6 weeks in your 2024 estimate. Dividends, rental income, residuals, you can check on your tax returns and see what those were and estimate for 2024. Anything that would show up on your tax returns needs to be included. You do not, however, need to include gifts under $17,000, cash gifts. So if you have a very generous aunt, uncle, parent that's helping you out and their cash gifts are under $17,000 a year, you can exclude that. Happy to answer any questions about income estimates at the end of the presentation. So now we're going to move on to the different programs that you're eligible for. So Medicaid, as I've said before, is comprehensive health insurance at almost no cost. By almost no cost, I mean there's no premiums. You don't pay a monthly premium. There's no deductibles, and there's almost no copays. The copays are very, very tiny, like $5, $3. It covers you for 12 months. And in most states, you can apply through the marketplace. You can do that in New Jersey as well, but I would not recommend it. The next slide, we'll talk a little bit about the enrollment process in New Jersey. But for now, let's just talk about eligibility. So we are talking about Medicaid eligibility for anybody under 65. 65 is an important cutoff. The rules change for older people. So you have to be eligible for Medicaid based on your income. If your income as a single person is less than $20,000 or roughly $20,000, or if you're married or a single parent with a child and your income is below roughly $27,000, you're going to get Medicaid. In New Jersey, they want to see your monthly income. They're going to base your eligibility on this month's income. So your income in the month you apply for Medicaid has to be below $1,677 as a single person, or $2,268 as a couple or a parent and child. Please note that in New Jersey, immigrant adults have to have legal permanent resident status, which means a green card, for at least 5 years in order to be eligible for Medicaid. So what do you do in New Jersey to apply? You can go to the marketplace, but we do not recommend it. So if you think you're eligible for Medicaid and want to apply, go to njfamilycare.org. That is a faster way to apply for Medicaid, sorry. And you can check the status of your application at this phone number, 800-701-0710. Again, 800-701-0710. Please know that New Jersey is unfortunately pretty dang slow with the Medicaid applications. So it can take 45 days to get approved. You are approved and backdated. So that means that once you're approved, they will backdate it to the date that you applied. But still, it's a little bit like sitting on pins and needles for that wait. If you don't qualify for Medicaid, you can always buy a qualified health plan. You can pay full cost. Nobody wants to do that. So you want to tell them what your income is so that you'll get a discount. I can't tell you what it's going to cost because the costs vary greatly by county, by the size of your household, by your income, by the level of coverage you want. There's a lot of factors. It's actually a good thing that I can't tell you what it is because it is very individual to your situation. But what I can tell you is most people are going to get tax credits to lower their income because the Inflation Reduction, to lower their premiums, because the Inflation Reduction Act instituted more generous advanced premium tax credits, which was great. So this tax credit is a discount that you get off the price of your monthly premium, and it's based on your annual income estimate. The payments are made to the insurance company. If you're married, you have to file jointly to receive this. You cannot be married filing separately. This is a tax credit and must be reconciled on next year's tax returns. So if you make more money during the year than you estimated, you may owe money at tax time. That's why you want to estimate your income as accurately as possible or update your income in your marketplace account to avoid this. Please know that you can always go into your marketplace account and update your income. In fact, you should. If it changes by more than a couple $1,000s, you're going to want to go in there and update it so that you have accurate premiums based on your income. And you're going to want to update it if it goes up or down. If you don't do this, if you say, I think I'm going to make 20,000, well, that's a bad estimate. I'm going to make $30,000 next year. And you end up making 40,000 and you haven't updated your account, the IRS is going to ask for the money back on your advanced premium tax credit. They're going to ask for the difference between the tax credit you got at the $30,000 estimate and the tax credit you should have gotten at $40,000. So this is progressive taxation. In other words, you make less, you get more. You make more, you get less. Okay. They're going to ask for that reconciliation on the tax return. It's not a penalty, but you may have to pay them some money back. The opposite is true too. If you overestimate, you're going to get money back from the government. This is from the Get Covered NJ website. So I entered a zip code, my former zip code in Jersey City. And this is me right here. And you can see that I am estimating an income of $30,000. So if that's me in Hudson County, I'm going to get a tax credit of $783 a month to buy insurance and an additional savings of $50 a month. That's something that that New Jersey has instituted that's different than the federal guidelines. So this is pretty generous. This means that most of the bronze level plans are going to be free for me at that income level. And several of the silver level plans are going to be free as well. So how do you pick a plan? I see on social media all the time, people unfortunately asking the wrong question. The wrong question is, give me the name of a good insurance company. There are no good insurance companies. They all want your money. That's how they're designed. They're designed to make money. So you don't want to think of them as good insurance companies or bad insurance companies. You need to understand how you use the healthcare system, what your budget is, and what your doctors are in network with. And then you're going to make your decision based on that. Okay. So I would take out a piece of paper and write down how I've used the healthcare system in the last year. Remember, anytime you get lab work, that's possibly hundreds, if not thousands of dollars right there. Anytime you pick up a prescription, maybe you had insurance and it cost you $10, but maybe the full cost of that prescription is $300. When you see a therapist, when you see a primary care physician, when you go to urgent care, all of these things are examples of using the healthcare system. So you're really going to want to think about how often you use the healthcare system and for what. You're, of course, going to think about your budget. You're going to call your doctors and ask them what they're in network with on the marketplace. And then using all of that information, you're going to pick something. You're also going to take a look at the summary of benefits and check to see if the benefits that you need are subject to a deductible. You want to deal with a deductible as little as possible. So if on your piece of paper it says, I went to see my PCP twice and I got lab work once, then you're going to want to pick a plan where you don't have a deductible if you see a PCP and get lab work. These are the different levels of coverage. For most people, there's also something called catastrophic, which is for people under the age of 30, basically very similar to a bronze plan. But bronze is the lowest level of coverage and platinum is the highest. Bronze will be the cheapest every month. Platinum will be the most expensive. Bronze will have the highest deductibles, high, $4,000, $3,000. It will also have the highest out-of-pocket maximum. So basically, the bronze plan makes sense for people who don't believe in Western medicine, never see the doctor, but want to make sure that if something really serious happens, they don't owe on a $250,000 hospital bill. So it has that out-of-pocket cap of at maximum $9,100. Again, that's going to change slightly next year. But that's what that does. It just makes sure that if something really awful happens, you don't hemorrhage money. That's what's called a catastrophic plan, but the marketplace calls them bronze plans. Platinum is for people that need a hip operation, are pregnant, are HIV positive and have very expensive meds. Anybody, going through chemo, people that are high users of the healthcare system are going to want a platinum plan. It's more every month, but some platinum plans don't even have a deductible at all. And their out-of-pocket maximums are very low or lower. Maybe it's $4,000 instead of $9,100. Gold and silver are in the middle, with silver being the most common type of plan that people choose that sort of balances your monthly premiums and your deductibles. So in New Jersey, these are the companies that you can choose from. You may not have the choice in every county in New Jersey between all of these, but these are the ones that you are going to see in most counties in New Jersey. Aetna, AmeriHealth, Horizon Blue Cross Blue Shield, Oscar, United Healthcare, and WellCare. We're almost done, and I'm just going to talk a little bit about what to do if you're uninsured, because I don't want people leaving here thinking, well, I can't afford insurance, I'm just never going to go to the doctor. We want to make sure that you get health care. So if you're uninsured, you're going to want to be prepared. So you are going to want to go to essentialhospitals.org and click on the members tab and see what the public hospitals are in your county. So these are hospitals that are required to see people who are uninsured on a sliding scale based on their income. So you will pay a certain fee based on your income. You don't have your choice of hospitals. You have to go to the one or ones that are in your county. You can also find community health centers for outpatient stuff. So you don't need a hospital. You just need a checkup. You need lab work. You need an x-ray. Check out the community health centers listed at needymeds.org. It's a fabulous website, and it lists all community health centers. Again, they also operate on a sliding scale based on your income. And Needy Meds will also show you pharmaceutical assistance programs. These are programs that are run by the drug companies, and they give their drugs away for free to people whose incomes are below their eligibility guidelines. So every program is different. The guidelines are different, but almost all medication is available through these programs. Nothing that you're going to sell on the street. But so many meds are available through pharmaceutical assistance programs. People just don't know about them, and they don't take advantage of them. So you can find the names of all of the pharmaceutical assistance programs, the applications, and the eligibility guidelines at needymeds.org.
Renata, I just wanted to let you know your screen share has frozen, so we are not currently seeing that screen of your presentation.
Oh, that's super weird. What are you seeing? Plans on the marketplace?
No, we're still seeing household member applicant at the top. I think we froze about 2 slides ago.
Oh, no, that was many. Oh, household number applicant. So you didn't see so did you see how do I pick a plan?
No. So that's the one we need to see. We haven't seen that or the different levels of coverage yet.
I'm not sure what to do because I am seeing it on my screen, and I'm not getting any internet interruption. Let me stop share and restart share.
Let's try that.
'Cause I am not. Can you see it now?
We can. Perfect.
Yeah.
Thank you so much.
All right. Sorry about that. Thanks for letting me know. So this was, the slide on how to pick a plan. And then I moved on to, whoops. Can you see the different levels of coverage? Okay, great. Okay, so you can see that. You can see the list of names of insurance companies. Okay, great. And then this was the website we were on. So essentialhospitals.org, needymeds.org. And then you can compare drug prices at pharmacies at goodrx.com. So pharmacies charge different pharmacies charge different amounts for the same drug. And a lot of people don't realize that. So you can go to Walgreens, you can go to Costco. The prices are going to be very, very different for the same medication. You can check out the prices at goodrx.com. They also have an app that you can download to your phone. So you can see, this is an example of Lexapro. You can see that Target charges $61 normally, and Walgreens charges almost 3 times that normally. And you can download discount coupons. These are perfectly legit. You're not getting like contraband medication. This is just discount coupons that the pharmaceutical companies make available. And it's one way that they actually keep the system that they like, that pays them a lot of money, in place. So use these discount coupons. You're not hurting the pharmaceutical companies, believe me. And if you're on a bronze plan and you have a deductible and you have an expensive medication, this would be the perfect opportunity to go to GoodRx and see what kind of a discount you can get and where. So this is also a really, really great website. And that is it. I see that we have a lot of questions in the chat, which is awesome. So Samantha, feel free to get started with the questions.
Great. I'm going to stop the recording.